any malpractice case is not simply that something went wrong. That's not malpractice. Malpractice is a departure from good and acceptable medical practice. And you only get that by having another doctor say that this is a departure from good and acceptable medical practice. In New York, at least, we can have doctors testify outside their specialty. In other jurisdictions, you're not allowed to do that. Like if I'm suing a dermatologist, I would need a dermatologist to say this is outside the standard of care.
Welcome to Skin Deep. I'm Dr. Anna Chacon, and today we have a very special guest joining us. Get ready for some expert insights you won't want to miss.
What led you to focus on this area? Like what made you decide you want to do this?
The general practice of personal injury I got involved in because I know in medicine, you're very familiar with being an intern and then a resident and kind of learning while still being in school for a little while. And law is similar in that typically as a lawyer, as a law student, you get a job after your second year. You're considered a summer associate.
Like an intern, sort of.
Yeah, sort of. I mean, and because let's face it, in law school, there's a lot of theory taught, and you become a summer associate working at a firm to learn how to apply that theory to the practice of law. So I ended up going to work for a personal injury firm that was handling at the very beginning of what's called a toxic tort case.
Okay.
And that is a case where 13 people, children, all had developed leukemia from living near a toxic landfill.
Wow. Where was landfill?
In the Bronx.
Oh, wow.
So that's how I got started. And the firm I went to work with, they hired me after that summer. I started after my third year of law school. After I graduated law school, I started there. And their other part of their practice, other than personal injury, was medical malpractice. So that's how I ended up getting involved in medical malpractice. Not every personal injury lawyer handles medical malpractice.
What would you give for advice? You know, my practice in person is a year old. My own practice is about 3 years old. I did mostly telehealth first, and then I have like a hybrid in-person and telehealth practice. Telehealth was always considered kind of safe, kind of a little bit shielded from a lot of these cases. But yesterday I actually read in the paper that a family is suing Amazon's One Medical because a patient actually died right after a visit. Was giving an inhaler and then just went to the ER and just straight up died. And at the visit, virtual visit, just was given an inhaler. But what would you kind of recommend, your top recommendations to doctors so this doesn't happen to you, especially newer doctors that maybe are on their own? They don't have the backing of a big legal team like they do at hospitals like Cleveland Clinic. That's where I initially worked. What can you do to help yourself?
There's a few different things in the question. First off, anyone can bring a lawsuit. And in some states, it's not even required that you have any sort of
merit
sign off on merit to start a lawsuit. In New York, where I practice, after you file your lawsuit, you must submit a certificate of merit that shows that your case, you are attesting to the court that your case has been reviewed by a medical professional and that there is merit to it. That doesn't always mean that ultimately you're going to win the case, but there's a reason to believe that there's a lawsuit here. That's what you're saying. And also remember, unlike an auto accident case. I tell my clients who come to me with an auto accident, you're sitting at a stop sign and a person hits you in the rear. And after that, your knee goes into the dashboard, you have a torn meniscus, you need surgery. I can tell that person the minute they call me that they have a lawsuit because, you know that there's liability there because they were sitting still when they were hit.
Yeah, they weren't doing anything.
They weren't doing anything. That's the lawsuit, guaranteed.
Yeah.
But Every person who comes to me with a potential medical malpractice case, they are told that I can't tell you. First, I have an idea. I've been doing this a while, and I get paid on contingency. So as you can see from my face, I'm used to eating. So I usually get it right. But um, any malpractice case is not simply that something went wrong. That's not malpractice. Malpractice is a departure from good and acceptable medical practice. And you only get that by having another doctor say that this is a departure from good and acceptable medical practice. And in New York, at least, we can have doctors testify outside their specialty. In other jurisdictions, you're not allowed to do that. That like if I'm suing a dermatologist, I would need a dermatologist to say this is outside the standard of care. And remember also, the standard of care depends on where you are. And by that, I mean the standard of care in New York City, in Miami, is different than the standard of care in a rural community in upstate New York. It is different because it's a different standard of care because it's a standard of care in the community at the time of the incident. It's, so malpractice cases are really quite a different breed than a standard personal injury case. So, again, the fact that someone brought a lawsuit, I can't speak to the merits of it. I just don't know. But it could just be that someone brought a lawsuit. Doesn't mean, anything. The other thing you said is, what about doctors who don't have, kind of the army of legal advice that a big hospital has? Well, that's true and not true in that every doctor is carrying malpractice insurance. And your malpractice insurance, if you read your policies, and I advise everyone always read your policy. But if you get a claim letter from a person, an attorney who says, I'm investigating you, you notify your carrier right away. Your carrier right away assigns a risk assessment person and an attorney who's going to represent you. And the firms that represent you are almost always big firms. That's who does legal medical malpractice defense. So you do have an army, everybody. I have encountered on rare occasion a doctor who doesn't have coverage, but that is generally not a thing. And also keep in mind, it also depends on your specialties. I don't know if you're aware, but dermatological malpractice accounts for 1% of malpractice cases filed in the United States. It's very unlikely as a dermatologist to face a suit. The percentage of dermatologists who will be sued is about 13%, over the course of their career. Compare that to OBGYNs, it's about 62% of them at some point are going to face a lawsuit. And surgeons who only operate out of out of hospitals, it's about 90% of surgeons at one time or another are going to be named in a lawsuit.
Wow. I didn't realize it was so high.
Well, but keep in mind, I've had surgical malpractice cases. What happens is there's generally someone I allege made an error, but there's 3 or 4 other doctors in that surgical suite. You must name them all because you're going to need their testimony. It doesn't mean at the end of the day, they're still going to be in the case. And that's where that statistic comes from.
Oh, okay. All the people that are named.
I mean, anesthesiologists are named a lot because they're in the operating room.
They're just there.
They're there. But at the end of the day, they're not the target defendant.
Within dermatology, though, I'm curious, what's this percent? Is it mostly Mohs surgery? Is it cosmetic? What is it skewed towards?
Well, I don't have an actual breakdown for where that, 13% would be, but I could hazard a guess. As a general rule, it falls into 2 categories: inaction or an error in action. The inaction cases are the failure to diagnose skin cancer cases. That's the most common. And to me, if you ask me, I would say almost all cases where a dermatologist is involved in a suit, it's a failure to diagnose skin cancer.
Failure to diagnose.
Yeah,
Okay.
that would be my guess. The other cases fall into the category of errors generally in like skin grafting after the removal of something. So that's where I say that's an action case as opposed to inaction, the failure to diagnose case.
What about this failure to diagnose? Because I know it's happened to me, but you ask someone to come back and they just don't. You send automated reminders. I always give patients a follow up, even if they really don't have anything to follow up with, it's as needed. But I usually almost always give patients a follow up because I think even if they come back and they have nothing, you're still documenting that they have nothing. They came back, did a full skin check, and it's all clear and we're good. Even once a year, is a good time to have a skin check. But what if they just don't come back? They're kind of seething in anger and they approach, a personal injury attorney like you. You've told them they should come back. You've documented that in your notes. You even have auto reminders that are sent, which I do with all my patients. And they just say, okay, failure to diagnose, failure to this grew and, all of that. Do you find that that's common, or it's more the person who saw doctors, thought there was a problem and just nothing was done about it?
Okay, let's just to backtrack a little. Almost, I can tell you from my world and my friends who do medical malpractice, I get asked or consulted on bringing a case far more than the number of cases I bring. So that means the person who you're describing, who went to see their dermatologist in December 2021, was told to keep coming back once a year and never went back, and then is diagnosed with cancer in December 2024. And they say, well, that first dermatologist missed it. That's not a case I'm even investigating. I mean, it's just not, because it's not, I can tell you from the medicine, it's not true. It didn't exist in 2021.
Right.
So
Right.
that's part of it. But remember, again, people can bring lawsuits. And in some jurisdictions, you don't need even that certificate of merit. But just because they bring a lawsuit doesn't mean that it's successful. And in the case you described, where you told somebody or somebody was told you have to come back, you come back once a year. My own dermatologist, after my last visit, told me come back next year. Said you
Yeah.
have a year. There was nothing suspicious.
Right. Right.
He examined everything.
Yeah.
He said there's nothing suspicious and come back in a year. So I don't think that's uncommon for someone who has nothing to wait a year. And
Yeah.
it's,
Yeah.
especially here in the Northeast, it's not like you're down south, right?
Miami, Florida.
Well, that's what I
Yeah.
thought. So let's face it, it's a much different environment in terms of exposure to the sun where you are than where I am.
Yeah, exactly.
So, um, but in a case that you described, I suspect your attorneys who are going to be told right away that this is what it's about. They're going to get your records right away. They're going to see all the time reminders you sent. They're going to call the plaintiff's lawyer and they're going to say, look, you have no case. Your person didn't come. At least in New York, we have comparative negligence. So a plaintiff who does things incorrectly is comparatively negligent. And if there is an award against the defendant, it is reduced by that plaintiff's comparative negligence. So the jury is told there can only be 100%. So how much percentage is the defendant responsible for? How much is the plaintiff responsible for? So let's say the plaintiff is 80% responsible because they didn't return for their visits the way they were supposed to. And the doctor is 20% responsible because they did miss something. And there's an award of $100,000 for the plaintiff. That award is reduced by 80%. So the actual award is $20,000. So we do have the concept, but the case you described, because of the way skin cancer develops generally,
Yeah.
if it wasn't there and then the person just didn't come back and 2 years later they say, oh, you missed it, the odds are you did not.
I actually was approached one time in the Virgin Islands. I was traveling, and it was a patient had seen me in a hotel, heard there was a Cleveland Clinic dermatologist there, and said she almost lost her eye because some dermatologist missed it at Cleveland Clinic 5 years ago. Something just like that, about one of my colleagues. And I told my colleague about it. I said, you don't even have to tell me. I'm sure you gave her a follow up, and she just didn't come back. And yeah, it just is. But I'm glad to hear that. So the certificate of merit, what do you need for it?
You are swearing to the court that a doctor has reviewed your case and believes that there was a departure in good practice. And that doctor who reviewed it may not ultimately be the expert you're using, but it could be, a different medical professional. And we don't have to disclose who that is in New York. You just have to affirm to the court. And I can tell you as an attorney, it is truly bad practice to lie to the court. So hopefully nobody's doing that. But, in my own cases, before I start a lawsuit, again, because we work on a contingency model and medical malpractice cases are among the more expensive cases to bring through the court system. It's just an expensive process. Getting the records is an expense. Often they're voluminous. I have a case now where I just got medical records. The records are 1,100 pages. So just to review the case before I know there's a case, that was $850. Then the doctor who you have to retain to review the case, that costs $7,500. So before I even put pen to paper type out a complaint, I've spent over $8,000. And that's what you do on every case. So it's an expensive proposition to bring the lawsuit. And so you're careful about the cases you bring.
And how do you get these experts to help you? How do you get an expert in dermatology? How do you get an expert in all these fields?
Well, it's interesting, and you might not like what I'm about to say, but it's not bad. It's just from the plaintiff's personal injury perspective, we refer to doctors as having the white coats of silence. One doctor doesn't like to testify against another doctor, especially in the same state. And so often you have to get doctors from different states to testify for plaintiffs. And that's especially true in certain fields. Neurosurgery, it's notoriously difficult to get an expert. They do not like testifying against each other. And,
yeah. Well, they could also have a complication one day and need each other. So that's, one of the
absolutely
reasons.
True. So, how do you get the experts? Well, sometimes I've been doing this a number of years, and I know some doctors who do testify for plaintiffs in different specialties. And so I've gone back to them for certain things. I had a very bad bed sore case where I felt the hospital, those are almost always hospital malpractice cases. And generally they're not technically doctor cases, they're nursing cases. But
wound care nurses.
Right.
Yeah.
But you have to sue the hospital and the doctor, who typically is referred to as the captain of the ship.
Medical director or something like that.
Right. And so I have an expert who I've used in the past, and I work with her now on many cases that involve, decubitus ulcers, bed sores. So, and the same is true, another area that's notoriously difficult to get an expert is orthopedics. Orthopods will tell you it's not like a puzzle when you break a bone. It doesn't always necessarily go right back into
together.
The same place.
Yeah.
So, they give each other a wide range of latitude, especially, in areas where there's so many bones, like a wrist fracture. I've been consulted on these cases. I turned it down, but, a person who went in had a horrible wrist fracture. Okay. And there's many bones in the wrist. I'm sure you had to memorize the mnemonic
Yeah,
to get
I
through.
did. Yeah, bones on the foot, bones on the hand. Yeah.
And so my client no longer had a full range of motion. And that's what the complaint was. And I did call an orthopod who I worked with in the past, and we're friendly. He didn't even charge me for the consultation. And we went through the notes, and I had the films. And he just said, Mitchell, look, it's to some degree, it's an imperfect science, but the doctor did the best they can. The person still has, 85% range of motion, and it was a horrible fracture. So I myself, as a child, had a horrible fracture in my arm. And, technology was different then. I mean, I'm not saying I was with the dinosaur, but technology was different. And so I don't have full range of motion in one of my arms from the fracture, even though I think the doctor did a great job putting it back together.
I once heard, and maybe it was like many years ago in medical school, that if you're nice, like if you're just have a good relationship with the patient and the people around you, you'll just be less likely to be sued. And that's actually my malpractice, which I use AON. The vice president told me the same thing. She's like, we had a case one day. We called the doctor, and he was like a total jerk, and I just told him, that no wonder you're getting sued, all these other things. But do you believe that, or is that kind of like a myth?
No, it's 100% true. I mean, there's
Okay.
no doubt in my mind that that's true. That, your rapport with your patients is key. In Massachusetts, I think it was Mass General, or it might have been Brigham Women's Hospital. I don't remember, but they tried a study, and when the doctors made errors, and it does happen, the doctor apologized to the patient for the error and admitted what had occurred and admitted the error. Now, they had law in place that couldn't figure into a lawsuit if there was one. Okay, it was shielded from that, so it couldn't be used as evidence. What they discovered was the number of times that patients sued was reduced greatly, because arrogance is a killer for doctors with regards to patients. I mean, I mean that in terms of, if things aren't going right and the doctor is really arrogant about it all, A, they're going to be sued, and B, the jury's not going to like them either, you know?
Yeah.
I mean, and so I think, look, it's like in a sense, it's like any service job.
Right.
I have to get along with my clients. You have to get along with your patients. You have to listen to them. Yeah, you have to be empathetic to them. And I think if you're not, and then something bad happens, then yes, I think there's more likely a chance you're going to get sued. Whereas, if you have a great rapport with I've heard from many people, and it happened recently actually, where I really do believe that there's a case there that the doctor really did depart, and it caused significant problems for the person. And so I've only been talking to the wife, because the husband's the one who's still going through all the problems. And the wife said to me, I don't know if he'll sue the doctor because he just likes him so much. So, it's definitely true.
And then two last questions. These are just approaches that I've taken over time. How important are notes? And then how important is one thing I've got into the habit of doing is I always have, I never see someone by myself. If it's a virtual visit, I have a virtual medical assistant. If it's an in-person visit, I have an in-person medical assistant. I just think it's, they help in other ways. They help with note taking, they help facilitate the visit, but also they help make sure that, if there's ever an issue, there's another person that was there, you know?
Well, I think in the modern world, it is very important to have another person there, or a person sitting right outside with the door open. I think that's very important in the modern world for every encounter. I do it with my own clients. I think it's equally important for doctors, especially in situations like yours, where to do a proper exam, often the person must disrobe.
Yeah.
And
Yep.
you know, and I think it's very important they have somebody else there who can attest to and testify to, if need be, really what happened. Notes also equally important. I think you have to document the interactions. I think it's a good idea. I mean, I know in the old days, and you still see it from time to time, you doctors are notorious for having horrible handwriting. Just horrible. But
Yeah.
in the modern world, you're almost all typing it into some sort of program. And so the notes have become quite a bit easier to read. But I think it's very important to document what occurred, especially if something was done at the visit against your advice. Then I think you better make sure that's in your notes. You're seeing a person repeatedly, the person has had some, minor skins. You've had to, do some minor things to remove certain marks on their face or whatever. And you tell said person, look, you're in a high risk category. You're very fair skinned, and living here, you should be going out with no less than SPF, 50 on. And at the visit, the person says to you, Doc, I use baby oil. Well, that should end up in your notes, because that down the road is totally counter to everything you've said. And it occurred. And you better have a note for that, so that it's not just because if you don't have the note, down the road, if something happens, you'll say, oh, they told me they use baby oil. And the attorney for the place is going to be like, well, that's a very convenient thing to say because that's horrible, but it's nowhere in your notes. So, make the notes so that you have the backing that you need. I just think documentation is crucial for the medical field.
All right. Thank you so much. I gotta go, but
Okay, Doc.
But thank you.
As I said,
on a Saturday for me. Thanks.
You're
and
going,
for else.
you're going out in the sun. I really have snow here. So
Okay. All right. Well, thank you so much.
You're welcome. Thank you for
day.
having me on.